Hi, this is Dr. Nick. I'm the Incrementalist. I'm here with incremental improvements for your business and life.
And I'm Fred Goldstein with Accountable Health, providing consultation in population health and healthcare system redesign. So let's start today, Nick, talking about COVID and the updates we've had since the last time we were talking.
Good Lord, is it like 1 day or 2 days since we last spoke? And there's all this new news. The target continues to move as it does very quickly. That's good news in that we're learning more things and more insights coming out. I think the big change currently is we're now advocating that people should use masks in all instances, particularly when they're outside. Why did we not do that before? Well, there was an issue of shortages of masks that I think we saw. We didn't want our frontline staff, who are essentially at high risk of exposure as a result of being closely in contact with patients that have the disease and are shedding virus. And also learning experiences. There's been a number of papers that have been published that essentially demonstrate the limitations of the droplet transmission is, I don't want to say as important, but it's certainly equally as important in terms of the prevention of disease. And we also know that disease occurrence is increased with increasing amounts of viral exposure to the viral particles. So these masks both protect you from transmitting, but also can help prevent, especially when you're in close contact with other people that are shedding the virus. The other thing that I would add that I think is really interesting, we've seen some results of this. We're seeing some impact in the GI system. So some negative consequences. People are reporting diarrhea as one of the symptoms, certainly in the milder cases of disease. But what's interesting about the additional data points that are coming out of this is that people are shedding virus for somewhere of the order of 5 weeks post their infection with COVID-19 coming out in fecal matter. That's interesting both from a spread standpoint. So, by the way, if you're not washing your hands when you come out of the toilet, ew, is all I can say. You should be. I still can't believe I see shocking number of people that used to do that. I hope that that's forever purged from our activities. But the other thing that's really interesting, and I think the innovation that I love that I've seen, is can we track sewage output in cities to trace back COVID viral particles to see where we're seeing more outbreaks because we're seeing more of the virus in the sewage effluent coming out from these areas. That to me is an extraordinarily exciting opportunity because now you can start to focus resources in those areas.
So this essentially gets to that whole point that we've talked about of measuring people's stuff right where they live. So ultimately you could measure the viral load within your fecal matter.
Right, and in a passive way, we can do it on an effluent. Okay, so we only get a building, but hey, if building on 54th Street and 7th Avenue suddenly has a massive effluent of viral particles, we say, gosh, we might want to focus our resources and perhaps quarantine that building for whatever's going on. So it's this passive acquisition of data that gives us more insights and more information.
And interesting, you mentioned the masks. One of the things I noticed, that, as a matter of fact, I just responded to something this morning that somebody put up in the newspaper where they said, "Doctor, why are you recommending wearing masks? We know the viruses are really small and they're going through it anyhow. Can you give us a study?" Well, I happened to post one up there that showed a study out of the UK using various surgical masks that the reduction was greater than 1 in all of them, although virus was found on the backside of them all, but an average 6-fold reduction in virus, which obviously is going to have some sort of an impact for individuals if that's in fact going on.
Right, and that's especially important when you consider that we believe that just exposing you to a single virus particle doesn't mean that you're going to get COVID-19 infection. It actually has a proportional, so it has a dose response. So the more virus you're exposed to, the more likely you are to get infected. So the less virus that you get exposed to, the less likely you are. So any prevention that reduces that, clearly a benefit.
Well, fantastic, Nick. It's been a pleasure talking to you as always. Great information. Hopefully people will recognize use the restroom facilities and clean yourself. It's probably a good idea to be wearing a mask. And the best thing that everyone could do is sit there and go ahead and self-isolate in their homes, obviously.
Thanks very much, Fred. I'm Dr. Nick. I'm the Incrementalist here with incremental improvements for your business and life.
And I'm Fred Goldstein with Accountable Health. Thank you for joining us.